Meniere's disease is a chronic condition that affects the inner ear, causing symptoms such as vertigo, dizziness, hearing loss, and tinnitus. So don't skip the video and watch until the end. While there is no known cure for Meniere's disease, certain natural treatments and lifestyle changes may help manage the symptoms and reduce the frequency and severity of dizziness episodes. It's important to note that these natural treatments may not work for everyone, and it's always recommended to consult with a healthcare professional before starting any new treatment regimen. Here are some natural approaches that may be helpful. 1. Diet modifications. Some people with Meniere's disease find that certain dietary changes can help reduce their symptoms. Common triggers include caffeine, alcohol, salt, processed foods, and foods high in sugar. It may be beneficial to keep a food diary to identify and avoid any specific triggers that worsen your symptoms. 2. Salt restriction. Reducing your salt intake can help decrease fluid retention and alleviate the symptoms of Meniere's disease. Limiting processed foods, fast food, and adding less salt during cooking and at the table can be beneficial. Stress management. Stress and anxiety can exacerbate symptoms of Meniere's disease. Finding effective stress management techniques such as exercise, meditation, deep breathing exercises, and engaging in hobbies can help reduce the impact of stress on your symptoms. 3. Adequate hydration. Staying hydrated is important for overall health and may help reduce the severity of Meniere's disease symptoms. Aim to drink enough water throughout the day and limit your intake of dehydrating beverages like caffeine and alcohol. 4. Gingko biloba. Some studies suggest that Gingko biloba, an herbal supplement, may help improve blood flow to the inner ear and reduce dizziness. However, evidence is limited, and it's essential to consult with a healthcare professional before starting any new supplements. 5. Acupuncture. Acupuncture, a traditional Chinese medicine practice, involves the insertion of thin needles into specific points on the body. Some individuals with Meniere's disease report improvements in symptoms after acupuncture treatments. It's recommended to seek a qualified acupuncturist for this treatment. 6. Vestibular rehabilitation exercises. These exercises aim to improve balance and reduce dizziness by stimulating the vestibular system. A physical therapist specializing in vestibular rehabilitation can guide you through exercises tailored to your specific needs. 7. Ginger. Ginger is a natural remedy that has been used for centuries to alleviate nausea and dizziness. Consuming ginger in various forms, such as ginger tea, ginger capsules, or adding fresh ginger to meals, may provide some relief. If you like my video, then subscribe to my channel. Thanks for watching.